All right, let's see question number 6. Okay. All right, so many patients have heard about PGT-A but aren't always
Mhm.
sure what it is. So what is PGT-A? Who may benefit from it? And what are some common misconceptions
Mm,
about embryo genetic testing?
yeah. So PGT-A, let's just start with what it is.
Mhm.
PGT-A stands for pre-implantation genetic testing aneuploidy. It is, people will call it genetic testing of an embryo. What it involves is it is for somebody who has undergone embryo creation in some way, either with their own eggs or somebody else's eggs, their partner's sperm or a donated sperm, but some egg plus sperm to generate an embryo. That embryo has grown to a type of embryo that's called a blastocyst. That embryo has about 150 cells in it, and you can take a few cells off of that embryo before you freeze it, take those cells, amplify the DNA, and do some genetic testing. Okay. What that testing is looking for is a chromosome count. So this is something very commonly used in IVF cycles. And the true purpose of it is to identify the embryos that have the highest potential, the highest chance for implantation, the lowest chance for a miscarriage, right? It
Mhm.
identifies the sex of the embryos, so it's used in that setting as well. Um, I think the most common misconception about it is that it gives you a healthy baby. People will come and say, I want to do PGT-A because I want a healthy baby. And healthy, of course, they mean, that that baby does not have autism and doesn't have any diseases and it doesn't have any birth defects. And so obviously these things are not common, but that's not what you're testing for in the PGT-A. I'm going to use another analogy because I like analogies. If you
Me
think
too.
of if you think about genetics like a bookshelf, right? And we all three of us, or all of actually, I'm going to say all of us in this room have 46 books on our bookshelf. We got 23 from mom and 23 from our dad. And our goal is to make embryos that have 23 books from the egg and 23 books from the dad, or
Mhm.
from the sperm, excuse me. That is what it's looking for. An individual with Down syndrome has an extra book, and you're going to see that in your testing, right? What you're
Mhm.
not going to see in the testing is the words on the page, right? So then there are thousands and thousands and thousands of genes, and those genes are the words on the pages. And, you know, almost all these things that I just mentioned are genetic and even polygenetic, meaning they're not even just caused by a single gene or a single word spelled incorrectly. So what you're not going to see is if the words on the pages are spelled incorrectly with your standard PGT-A testing. So I think that's the most common misconception about it.
Awesome. Yeah, that it is pretty crazy, like amazing that you can see all that. And thank you for putting it into that analogy. It makes so much more sense in my mind.
Good.
All right, next question. Let's see. Okay. So, if a patient has experienced multiple failed IVF cycles or recurrent implantation failure, what
Mhm.
additional evaluations or treatment options would you typically consider?
Yeah, I'm going to take this one at a time.
Yeah.
Let's do failed IVF cycles first and just define that as like you do an IVF cycle and you don't get a baby.
Yeah.
Now, in understanding that, it's really helpful to understand where that failure has occurred. Because if you think about IVF, there are a lot of hurdles that you have to get over to go, I started my shots and now I get a baby. You need to
Hmm.
respond to the medication. We need to get eggs. The eggs need to fertilize. The embryos need to grow. If you do testing, we need to get a balanced embryo with 46 chromosomes or 46 books, and then that embryo needs to implant. So, where are we failing? Right. So, I think it's super important that you understand where that failure is happening because how you fix it will depend on where you're failing. Right. And
Right.
so, I think that if you're not getting the response you want, you need to adjust your protocol or try to adjust your protocol. If we're having poor fertilization or poor embryo development, do we think it's an egg problem or a sperm problem? Is there anything we can do to optimize the egg and the sperm? Is there anything we can do to optimize on the embryology side? Is there anything we can do to prep, the sperm? Because again, I said sperm impacts embryo development. Um, or are we kind of, and then I think the other thing to think of, and this is where you guys probably would come into play, is after a certain number of failed cycles, if we think it's linked to an egg problem, at what point do you consider something that's going to give you a higher success rate like egg donation? Right. So I think that, that's how I think about failed IVF cycles is really understanding where why that failure is happening. Now, recurrent implantation failure is different because it assumes there are embryos for implanting, right? Whereas I just said overall failed IVF can be from, you can fall off at many different stages. Recurrent implantation failure says, I have embryos, pretty embryos, and they are not sticking. That is a
Hmm.
totally different problem, right? Now you
Yeah.
really have to shift your attention to the environment upon which you're putting those embryos. And that is, your standard testing, which we mentioned things like the saline ultrasound to make sure the uterus is normal. Often we're digging a little deeper when that's happening. I would argue that most of us would probably want to know if that individual has endometriosis if they haven't already been tested for it. Something like a her resolve is helpful. Often we're now transitioning from that saline ultrasound, which is direct imaging of the uterus, to like, let's do it, let's look inside. Let me put a camera inside there. Something called a hysteroscopy, where you can put a camera in the uterus and see is there something more subtle happening. Often we'll sample the tissue in there and look for inflammation or inflammatory cells. So again, it's a different diagnostic workup that's more focused on the environment because you have assumed in an implantation failure that you've gotten to the point where there's embryos there and they're still not sticking. Now, this is crazy, but sometimes implantation failure is still related to embryos, right? There's
Yeah.
something else going on in the embryo that you're just not seeing in that testing. Because remember, the
Mhm.
testing has limitations that's leading
Right.
to failed implantation. But almost certainly in that setting, you're looking at these other things as well.
Wow, yeah. So there's so many additional evaluations considering where you're what you're doing,
Yeah.
whether it's a failed
Mm-hmm.
IVF or recurrent
Mm-hmm.
implantation failure. But it is encouraging to know that there is these extra evaluations. You guys can figure out what this might be, and there's still additional options to explore,
Yeah.
you know?
Yeah, I mean, I guess the other one, right, is surrogacy, right?
Yeah.
So every once in a while, it's not very common, but you will just get somebody who you have transferred and transferred and transferred, and you cannot figure out why these embryos aren't sticking, and that's an indication for using a surrogate.
Hmm. All right, let's see question 8. Okay, so at what point might egg donation become part of the conversation? I know you touched on that a little bit.
Mhm.
And who may be a good candidate for this option?
Yeah, again, I think that people arrive at egg donation from different places. Some people need an egg donation to start their family because there's nobody in their family with eggs, right?
Right.
So that could be a male couple or single dads by choice. Anybody in their family who there is not an egg source. So that's autumn. That's where the journey starts. Okay. Um, Other people who might consider egg donation would be somebody who um, is older with low egg numbers. So they may approach this just they come right in and already, you review the chances of success of IVF with their own eggs and you're giving them numbers like 2%, 5%, and they say, "Oh, no, thank you." Right. Why would I go through all that and spend all that money for a 2% chance of a baby when I
Right.
can have a 65 to 85% chance with an egg donor? And so that individual may just start right there, right?
Mhm.
I would say, a lot of the time it's egg donation is reached from these failed IVF cycles. Not always, right? The other sort of indication or reason people is they have tried and tried with their own eggs and haven't achieved success. And they are ready to transition to an option that's going to give them a higher chance of success.
Awesome. Yeah, thank you for explaining that. I know egg donation can be an important part to many families depending on their individual circumstance.